This ancient exercise has a number of benefits. First of all, it allows the patient to activate all his kinetic chain. It is a very easy exercise to prepare, and the abduction movement is combined with the external rotation in a proportion that the patient regulates automatically. Let's have a look at the two different executions. The patient regulates the two components of the movement so that it does not force the joint rigidity. Obviously, it is an exercise that does not set a precise objective, and unfortunately, it stimulates the patient to activate some compensations. These compensations are difficult to avoid because the movement is rapid and spontaneous. We can reduce the effort required by applying a counterweight that lifts the arm. Or we can increase the force required by using friction. Therapeutic indications. The exercise is useful when we can leave out the problem of compensations, or because these do not occur, as in non-joint fractures, or because they are unavoidable, and we have to aim for the overall functionality. This exercise strengthens and mobilizes the thoracic scapula, and at the same time, the glenohumeral joint is strongly stabilized by the muscles. Therapeutic indications. The exercise is recommended for almost all pathologies. For example, for the fracture outcomes, the impingement syndrome, instability. The steering wheel mobilizes the shoulder in anti-flexion. The healthy limb does the work that moves the damaged limb. If we place the patient in a decentered position, also the direction of movement changes. This exercise is indicated for joint rigidity that can be forced, as for example for a frozen shoulder in some fracture outcomes, or in highly motivated patients. Contrary to the steering wheel exercise, here the anti-flexion mobilization is delicate. The force of the movement is supplied by the weight. The force for the return is provided by the patient with a minimum effort for the pectoral muscles. The level crossing exercise is useful for elderly patients because it can also be performed seated. You have understood that the purpose of the exercise is to gain in abduction, and that we use the external rotation movement to mobilize the capsule. Therefore, the exercise is useful when the movement is limited by a retracted capsule. At every session, after warming up the joint with an external rotation movement, we raise the height of the apparatus, and thus gain in abduction. Naturally, we must take the compensations into account, and try to defeat them right from the start. This exercise is recommended for cases of frozen shoulder or capsule rigidity. This exercise allows passive mobilization towards abduction, combining abduction with external rotation. If the elbow is at the center, the movement will be prevalently of external rotation. If the elbow is decentered from the apparatus, the movement will be prevalently in abduction. The machine allows us to combine the active movement of external rotation with the almost passive movement of abduction, eliminating in this way the risk of recruiting the deltoid and the compressive component. This proprioceptive exercise improves the sense of position. Changing the patient's position obviously also changes the direction of movement. I'm Anna Rispoli of ProRad, and I would like to present the ROTA to you. It is a device which we helped to design and was developed and manufactured by Kinosport. ROTA derives from the lapidary's wheel, and it is indicated to help therapists in the rehabilitation of patients with shoulder problems. I want to illustrate some of the possibilities this apparatus offers, starting from the more traditional exercises and arriving at the most modern. Therapists, obviously, can integrate this set of exercises with their own original proposals.